Okay, so I'm going to go over chapter 15 with you. I've got my book right in front of me. You can follow along. We're on page 234, 235. Okay, so we've talked about so far collecting blood as phlebotomist, but you might be tasked working in a lab collecting any more other than blood. And so what we're going to talk about right now, I'm just looking at the objectives here. Instead of blood, we're going to talk about collecting urine, fecal matter, semen. I've got nasopharyngeal swabs. Okay. Or swabs that will include throat or the nasopharyngeal cavity. Okay. Sweat, which is pretty rare. Other things that can be collected would be like amniotic fluid in a pregnant lady. Okay, we're going to cover these pretty quickly. The majority of this lecture is going to be right here between urine, fecal, and semen probably, and the swabs. So let's look at urine first. Okay. We can collect urine at different times. The first one would be a random collection, which means we collect a sample of urine randomly at any time. The next one would be an 8-hour or first in the morning, that's my own paraphrase, collection. Okay, and then the next one would be an extended large volume of urine called a 72-hour collection. And the same test can be done with each one of these methods, but sometimes collecting them at different times like this can provide different results depending on what we're looking for. Okay, random will be for a drug screen, you know, obvious, or just a snapshot of current, I'm going to say metabolism. Okay. You know, if we have excess glucose going on that's spilling out into our urine, we're going to see that. If we have protein spilling out into our urine, which aren't supposed to be there, we're going to see that. Current kidney functioning at that time, we can look at it. Okay. The next one is probably most useful because urine at this point, after 8 hours of sleeping, is concentrated. This is best for HCG testing, which would be human chorionic gonadotropic hormone. I may have mispronounced that. Gonadotropin. Human chorionic gonadotropin. It is concentrated in this 8-hour sample, so it's best for pregnancy testing if you're going to do it via lab and not at home or something. Okay. Usually this has to be delivered within 1 hour for these analytes within the sample degrade. And your book tells you deliver to lab within 1 hour of collection. Okay. In case you see a test question come up with that with regards to 8 hours. Okay. These right here, random drug testing, they can be refrigerated and taken to the lab up to, in my experience as a nurse, I've had over the weekend. So I can collect a sample on Friday evening. It can sit in the fridge until somebody comes and pick it up early morning, or even if they have a Saturday running, that lab tech will come by and collect all the samples and take them back to the lab. So they got some time here, but this one's best delivered within 1 hour. Okay, 72-hour urine collection. Would include a large volume of urine, or larger, over 24 hours. Okay, so that means either someone is going to deposit a sample into a cup, or you're going to collect it from a collection device like a catheter, add it to a growing amount of urine that's stored somewhere, probably in a fridge, and then it can be taken to the lab once that time has been completed and looked at for all kinds of different things. Things like culture and sensitivity. All right. Just like in blood, if we suspect bacteria is growing there, we're going to have to, one, culture that bacteria and grow it into colonies big enough to where we can identify it, and two, understand what antibiotic it's sensitive to. Okay, this can also be done with these samples. Those as well. All right, things like creatinine clearance. It's helpful to have a 24-hour collection because I can look at how much creatinine was produced in your urine over 24-hour periods. Okay, and if I collected them at like maybe 2 hours and 12 hours and so on and so forth, and then I also did blood at the same time, okay, I can say, okay, well, their blood had this much creatinine in it. Their kidneys should have been clearing at least this much at this time, and I can compare how good, I can compare those two levels and understand if your kidneys are working good or not, or if they're injured, if they're clearing everything they're supposed to. That's one of the advantages of a 72-hour collection, or a 24-hour collection, I'm sorry. 72 hours. Okay, I'm going to let you look on 236 on how to collect from a pediatric population. But make sure you do know that the most common procedure for collecting most types of urine, let me erase this, will involve some patient education. Okay. Especially if they're going to be helping you by collecting the sample, producing it themselves, and putting it in their own specimen collection cup. Okay? During a midstream catch, the patient is supposed to be instructed to clean their genitalia first. That way any bacteria that's on that surface doesn't get included into the urine and give us false positive for bacteria contamination. Okay? It's just like it sounds. The patient's going to start urinating, then they're going to collect it, then they're going to stop collecting it, put that cup down, and finish their stream or their void. Okay? It allows for microorganisms from the urethra to be flushed out and not collected in the sample. So when they've started that stream, whatever bacteria was in that urethra, hopefully it was flushed out, and then we've cleaned the outside already by instructing the patient to do that. So we would tell them to clean first with maybe a wipe that's antibacterial or antiseptic, or soap and water, or all of the above. Okay, start stream and then catch. Right, hopefully you understand why we would need to start the stream, then collect the sample, is to get any bacteria that could have been just hanging out in the urethra prior to out of that sample. Okay. Sometimes urine will not come out of a urethra. Sometimes patients have injury to the bladder, urethra or genital areas. They may have difficulty or inability to void due to injury. And so how do we get urine out of them? Well, there's a couple different ways. And I think this is it to wrap up urine. In order to collect urine from someone who's not going to put it in a cup for us, okay, they might be pediatric, as your book illustrates there, but they also might be catheterized. Okay, these catheters can be indwelling, where it stays in all the time because the patient has an inability to empty their bladder or empty it fully. Okay, they're usually changed every 30 days for cleanliness. It can be done more often. Oftentimes insurance will only pay for so much. You can also have like what we would call a straight cath, which is a shorter one, okay, that would be inserted to collect or empty the bladder to collect urine, and then it's taken out and left out. Both of these are done by nurses or trained physicians. Okay, phlebotomists won't do this because it has to involve some sterile procedures. Because we don't want to introduce bacteria into the cath or into the urinary meatus or the urinary tract that wasn't there before. Okay, and if we're going to be putting something into that, we need to make sure we do it in a sterile manner. Regardless, these can also be used for culture and sensitivity. Culture and sensitivity test, or pretty much the same type of test we've already mentioned so far. Okay, but you will need to make sure you get assistance in collecting that. Don't put a catheter in anyone, please. Okay. Then there's this thing called suprapubic aspiration. Okay, catheters can also be inserted in the suprapubic area and be indwelling. But what they're talking about in the book here more specifically is a physician inserts a syringe into your abdomen, pierces the bladder, and extracts urine that way. It sounds pretty invasive, but it is necessary in some reasons. So if you think about your anatomy, I got some hips here and some androgynous model. If this is your abdomen, your bladder is going to be located somewhere right in there, probably lower, actually. And so they will go in with a syringe and extract that. Okay. Oftentimes, if people are going to have an indwelling catheter through the urinary meatus, and it's going to never leave, they're always going to need it. Sometimes it's better for them to get a suprapubic catheter. That way, it's just a little bit more manageable for them. But two other ways that urine might need to be collected for processing in the lab. Don't forget, if you are doing a random screening, okay, last thing for urine here, and it's a drug screen, there's an important piece of documentation that has to go along with that, and that would be chain of custody form. Okay, just like if you were testing blood alcohol levels in the ER, you had to make sure you filled out that chain of custody form, so whoever handled that specimen was accountable, they signed off on it, when and where. Same thing with urine. That way, if it does end up being, used in court one day or something, the trail of who handled that can be followed. Okay. Let's go look at fecal collection for a second.